Hello, good evening. I am Dr. Nandini Gokulchandran, and I welcome all the participants of this webinar to this webinar on autism, recent advances, what are newer treatments for autism, and what are the benefits of the latest additions, that is integrative therapies. I'm Dr. Nandini Gokulchandran. I'm Deputy Director of Neurogen Brain and Spine Institute in Navi Mumbai, India, and I'm inviting you to this webinar. I would also like to invite Mr. Mohammed Akram, who is a Maldivian and is assisting us today in translating this English webinar to the local language, that is Devehi. Mr. Mohammed Akram has kindly volunteered to do this for easy understanding of this webinar, where in some places it will be a bit technical. Mr. Mohammed Akram he's a community health officer in Ihavandu, Maldives, at the Aminadio Health Center. So he has done Master of Public Health from Maldives National University. I welcome Mr. Mohammed Akram for this webinar.
Thank you, Dr. Nandini.
So, so I will go ahead and hopefully people will join as they come, and I'm going to try to make this as easy, as simple as possible for everybody to understand. So to start with.
So,
yes.
First of all, I will explain.
Sure.
Okay. Dr. Nandini, webinar pertama lecture ekorawani then Dr. Nandini Neurogen Hospital ge masa ekorawa doctor deputy director me webinar kuriya medani me ala hodun taka ekka autism ge farwaya miharu alan hodifawa hodunta tiabe fulna hame genis tinamata.
So thank you. Along with Mr. Mohammed Akram, I also attending is Ms. Majida. She is representative of the Ihavandu women's community and has been instrumental in improving awareness about this newer topic of autism and treatment of autism in Maldives. And thank you, Ms. Majida. So why are we here? So we are here because either we have a child with autism, or we are taking care of a child with autism as a therapist, as a doctor, or we know somebody in the community who has autism or other developmental conditions. So we are here basically to understand what more can we do for our children.
Algorithm kiwe kan bay me webinar ga bayre me wani algorithm ngi tere hama kom be follow me webinar ga bayre me ma be follow naki me autism kujje noniyam hasa ya benuwa enovis masalen hori kommes kujje ka farwa de mi he noniyam bedene veri.
So what is happening now? What has happened so far from various parents who have come to us and their experience, and what we are seeing in the community? One, that when there is a problem, when your child appears to be different from others, there is a developmental problem. What do parents do? They run from one place to another, they run from pillar to post. They visit different doctors, different therapists, different clinics to get some answer to what can you do for your children. And everywhere you are told there is no cure for autism. There is no medical treatment, and all that you can do is therapy, rehabilitation, and that's the way you have to go for a long time.
Me algorithm menge kujjegge ane ebes nokoladon terika mennoni aja hinda kamen horikama algorithm menna fahaga vejjiyama algorithm me korakama ki in hospital don anin hospital den ed doctor karin ane doctor karin hama dion e algorithm menna mehar koreven ekkama ki sei kama wati ve den algorithm menna abadus libe jawaba ki ane me daimi halle noni daimi farwai autism makannete. Then oi farwaya ki besta ke dinon noniam therapy enon farwaya noni daimi goteka kujja haldo libena farwaya nete.
However, this is not true anymore. There is something solid, something definitive we can do for children with autism.
එකමක මිහාරු මේවනේ මිමන්සර් බදල් වෙෆා මිහාරු මේකම දායමී ගොතිග්ග කොරවෙන් ෆර්වායෙන් එබොයි.
So let us look at what is new. What more can we do for our children?
එහෙම හිඟ මිහාරු ආදම් මිහෝදිෆාව ෆර්වාතක බේගතුම්.
So the old thinking was that once the brain is damaged, it cannot repair itself, or there is no way that we can help it to recover.
මේ අලගන්න මෙන්න ට්‍රැඩිෂනලි ආම්කෝ විස්නි ෆම යොන්න ගොතකි නාරුගේ සිස්ටම නාරුගේ නිසාමන් එවස් මස්සලේ දිමා වෙච්ච නම ඒ මස්සලේ කි හල්ලු කරවේ මස්සලේ නෝන් කම නොනි ෆරවායෙන් එක්කොක්කොගෙන් එකම එක්කොන් හල්ලෙ දිබේ කමෙන් නෝන් ගොතක.
But now the new thinking is that some amount of repair and regeneration is possible, and that is possible through cellular replacement and repair, what you normally known as stem cell therapy.
එකමක මිහා අලගන්න වෙන්න විස්නය ගොතක මිකම විස් අනේ කොරවෙන ෆරවාතකෙන් එබහොරි වකි මින්වරක කොරවෙන ෆරවාතකෙන් එබහොරි හම බයි ෆරවාතක එබහොරි හම එක්ක රිපෙයාර් කරේ ෆයිස් එහෙම අනේ ඒ ෆරවාය මිකියානමකි stem cell therapy.
So what was there earlier, the old view that only there is therapy, rehabilitation. You do occupational therapy, you do speech therapy, you do special education, only that is available.
මේ කුරීග වෙද්‍යම් අලගන්න මිහාරු මිකොරාකමකි අනේ කොදින්න බේස් තිනුමා අදී ඒ ගීතරොන් අනේ මේ occupational therapy, speech therapy, මිකල් therapy තහගේ තෙරෙන් කොදින්න නංගල කරේ තොමසකේ කරෝ.
But the new therapy is, a new view is that along with rehabilitation, we now have stem cell therapy, and we now have integrative therapies like oxygen therapy.
Namas miharuge visnumaki hama ane korim edenna vihe mihar mide farwataka ekko hama ege itoron ebahotte ane stem cell therapy ya adi ege itoron ane integrative ehen therapy tavis.
So when we do all of this together, then reversal of autism is possible. So when you do a combination of stem cell with rehabilitation with integrative therapy, it is possible to improve the child and reverse the problem.
මිහාර මිකොරවේ therapy තහක බොඩ අමාසි හිපාක මිහොන්නනි අනේ කොදින්ගේ behavior control කරන් මොලි බයියන් එක්ක ෆර්වා හොදෙන therapy එන්නෝ rehabilitation නකි නමස් මේ stem cell therapy ya integrative therapies තක අදි rehabilitation නා එක්ක එකුච්චාගේ බදි ෆසේහ ඕමගේ අනේ මග මිහාර ඔබයි හොලොයි.
So what am I showing here? Here, as you can see on one side, there is a leg which is fractured. Yeah, so many of us would have had some fracture in our life, either we fracture our hand or a fracture our leg, or you must have seen somebody in your family or in your friends fracture their leg or hand. What do? Do we start walking or doing exercises after the fracture? No. What we do is we fix the fracture, either by operation or by plaster. And only after the bone is fixed, then we do physiotherapy to strengthen the muscle so that we can walk.
Yeah, misalnya foto nanti pengen nawa kota, algan mengenai faanoni ate bindagen dia mah ane algan me etanu ga base naala noni am dagandu base moni casting naala then ane amayka di moodu dashak gos veli mode genne etane dangale novedetta ama egota ane
Similarly, why not for the brain? When there is a damage in the brain, you can see this is a scan of the brain, a PET scan. The blue part is your damage. The damage in the brain, if you don't repair it and we are just doing therapy, again, just like a fractured leg, the brain will not respond. So we have to repair the brain from inside. You can see this blue part here becoming green. So that means that the brain is improved, brain is functioning better. And once the brain is healed from inside, then you do rehabilitation, then you do therapy, the brain will respond in a better way.
Hama egota sekundigas mihonna massalaya mi farwa anokam hama ekane rehabilitation no rehabilitate farwata speech therapy ya di occupational therapy ekada farwata digen daimi hallen no hode misalaka hama faagavis algannu men mi cast ala gotan hama alafa ega fahum hama rangalu wegen den hama ane firevis mikora gota mi veli mode kal kankan korima firevis hallo libe bindagen da firevis libe hallo awas hama egota mi sekundiyak dimama massa dagavis hama sekundige hunna massala hallo koffa den ya goluwagen ituru farwata kurima kamun rikawawale awahe.
So what are we looking at? We are looking from going from hopelessness to hope, from wheelchair to standing and walking, from inability to think to be able to become an independent individual.
Em aluganu menna mihar visnamvi mi hasako mi hasahiya beenuwa kodinge mamba fanna ki visasaka wara boda mikamuge terege tan aharege ulenje honima eki kolokolo eki hope libi fa ekamako ekamun hallo no libi mi honnane hemma ekamako mi farwata ka ekkon e bote aluganu menna gondi ginna kojjawe samane kate doegen duwa ganne wena kamuge ummeedu.
So first let us understand about stem cell therapy. So what is stem cell? Like, just like we have stem of a tree, when we give water, it gives rise to branches and then leaves and flowers and fruits. Similarly, stem cells in our body give rise to many cells and then different cells in our body, like muscle cell, brain cell, and blood cell. Okay, so did you get this?
මේ අලුගොන්න මේ මිසාලක ගහක බදාම දාම හිගම්සක ස්ටෙම් සෙල් තෙරපි එක වහකම ඉදෙක්ගෙන ස්ටෙම් සෙල් දකි කොබාත ස්ටෙම් සෙල් දකි මිසාලක ගහක බලන්නම් ගහවේ සෙදි බොඩුවගෙන් අන්න අලුගොන්න මෙන්න ෆොරතම මේ ෆෙන්නනි ගස් ගාඬ එකම් ගස් ගාඬ හෙදි බොඩුවගෙන් ගොස් ඒව බදල්දුවේ මේ ෆතා ආදී එකි බාවයි බාවතගේ මේ වයයි බාලා හැම එකත ස්ටෙම් සෙල් දකි සම ආහාරමගේ හෂි ගාඬක හොන්න සෙල් තකෙන් ඒ සෙල් තකි හැම අලුගොන්න මේ හෂි ගාඬක හොරිහා ගුණවන්තක ඒව බදල්දුවේ ස්ටෙම් සෙල්.
Like, as you can see, this stem cells or even the stem has to be given proper water and fertilizer, then only it will grow. So this water and fertilizer is the rehabilitation or the therapies or the oxygen therapy, which is done along with the stem cells.
ගහකන් ඒවා ගොත මේ ස්ටෙම් සෙල් අලුගොන්න මේ හෂි ගාඬ ස්ටෙම් සෙල් ෆරවා දෙන්නාම ඒ ෆරවාග ඉතර ග්‍රෝ මෙවන්නේ නෝනියම ඒ ෆරවා අවශ්‍යයෙන් මෙදනියකි එයා එක්ක තෙරපි තක අදි ඒතර වරාජහිගෙන්වා කංක පුරේ වේනම හම ඒගොත ගහවෙස් ගසස් හෙදි බොඩෝම එව බේනොවේ ගස් කානාය අදි ෆෙන්.
So what are the different types of stem cells and what do these stem cells do? So how do stem cells work? First of all, you can see here one stem cell will multiply into many different cells. This is number one.
Fortama stem cell daki kobato badala mahinga fortama algon men waifaraton eme mati mifennani stem cell esel stem cell daki eta power etan has eta lakka cell daka emme cell de wegen medani gina wegen medani sa algon men hashi gandoga fortama ane karuba ganner stem cell take me honnani algon men hore gunawantake එහෙම ඒ stem cell ta multiply wegen gina wegen gossa ehen gunawantaka cell adeki wattaruge cell taka badalwa adi anna.
Number two, they improve blood supply in the brain or in the area that they are put. So if you put the stem cells in the bone, they will improve blood supply in the bone. So we are using the cells to improve blood supply in the brain.
Hama igota ane alon me ane secondia stem cell farwadi ifikama wajnamo secondia le hingoma adi hen harakaita secondia harakaita බේනවා එත බවර් සෙල්ස් එක stem cell no offer.
The number three, the cells can become different types of cells depending on where you put them. They can become muscle cell, they can become blood cell, they can become nerve cell. When depending on where you put them, they will become that type. If you put them in the brain, they become brain cells.
ඒගොත stem cell දකි මේ සෙල් ලෙවේ තනකොන් නොනි සෙල්ගේ ෆරවා දෙවේ තනකොන් එහොන්න සෙල්ත ඒගොත සෙල් ඔෆද්දා සෙල් දෙම සයක ස්ටෙම් සෙල් සෙකොන්ඩියල් දීම බ්‍රේන් සෙල් මිය ෆෙදෙන් නොනි නර්වස් සිස්ටම් වල දීම නර්ව් සෙල් මිය ෆෙදෙනි ඒගොත අල්ගොන හරිගණ්ඩෝගේ ඒකි ගුණවන්තව මෙහන ඒකි කහල ටිෂෝත මුෆෙද්දුමගේ ගාබිලකන් එබහුරි ස්ටෙම් සෙල්ගේ.
And lastly, they release growth factors or positive chemicals and which will help to repair the different parts, like repair the brain. So these chemicals or these positive growth factors, we call it, will improve the brain functioning.
I got me secondary core stem cell therapy ಗೆ ಸಬಬುಂ ಅನೆ ಎಬ ಒಫದ್ದ ಎಕಿ ಪಾವೆ ಬಾವತು ಕೆಮಿಕಲ್ ಅನೆ secondary ಇತರ ರಂಗಳ ಕೊರುಮಟ್ಟಕ.
So this is how different way that the stem cells will repair, regenerate or replace the damaged tissue.
දැන් ඒතක් ගොතකුන් එබ ස්ටෙම් සෙල් අනේ මසකේ කොද්දේව මේ හදාගේ ෆොන් ටිෂූත රංගල කොද්දින මාෂා අදි අනේ ටිෂූත ඉතර අනේ සෙල් තක ටිෂූත ඉතර උෆෙද්ද මාෂා අදි ඒ සෙල් අනේ හදාගේ හොරි සෙල් තහගේ බදලුගා ඉතර ටිෂූත තක සෙල් ත අනේ එතන ෆෝර් කොද්දිනම දැන් අලගොන්න මෙන් හම හදා බට්ටන් ජනනේ අලගොන්න මෙන් ෆොරතම අනේ මේ මාමිහාගේ අනේ බණ්ඩුගහම කරබේ ගණගෙන් මේ අන්න ඉරු අලගොන්න මේ අන්නනේ හැම අනේ ස්ටෙම්ස් එම් වර මද ස්ටෙම් සෙල් තහකම් ඉන්සානෙන් ඔෆෙදිගෙන් මෙන්නනේ එත බාවර් සෙල් තහකම්.
So stem cell therapy, basically it is a promising treatment where the damaged brain can be treated with healthy cells and the damage can be repaired.
මේ ස්ටෙම් සෙල් තෙරපි එකේ හැම වර කාමයාබ් තෙරපි එක ගොතද මේ ෆෙන්නනේ මේ සිකොන්ඩි එක අනේ හදාගේ පොන්න සෙල් ත නොනියාමු අනේ ගෙද්දුම පොන්න සෙල් තක අනේ ඒ සෙල් ත රිප්ලේස් කරන නොනියාමු ඊතර සෙල් තන් උපද්දා ඒ අනේ වෙෆවන්න ගෙල්ලො රංගල කරමු.
So what are the major types of stem cells? You know, where do we get these stem cells from? The first type is known as embryonic stem cell from embryos, which are 3 to 4 days old. Like when couples don't have children, they go to doctors, gynecologists, and the eggs are fertilized outside the body in test tubes known as test tube babies. So these embryos are put in the mother's womb, but some remain and they are getting wasted. So when those are cultured in the laboratory, they give rise to all different types of cells in our body, and those cells are known as embryonic stem cells.
දැන් මේ බලන්න ස්ටෙම් සෙල් කියනෙත් ඕර්ගන් වෙන දිබේනේ ෆොරතම ගොතකි අනේ ෆර්ටිලයිස් එකකොන් නෝනිය බිහකොන් නගා ස්ටෙම් සෙල්ස් දැන් අනේ සාලක අනේ මේ IVF කහද ට්‍රීට්මන්ට් හදා අයිරොස් බයි ෆාර අනේ මේ හරිගන්න බේරුගා ෆර්ටිලයිස් කරන්නාම අනේ බයි සෙල්ත ඒ හොන්නරි ಬಾಕಿ හොන්න සෙල්ත බේනකොගෙන් නෙගිදානේ මේ ගොතන් හොන්න ස්ටෙම් සෙල්.
So embryonic stem cells are from embryos. Then we have cord blood stem cells. Cord blood is when the mother and child is connected with the cord. When the child comes out, cord is cut, and from there the cells can be stored in different cord blood storing companies. Then that becomes another source of stem cells.
දැන් මේක ඊතරම් අනේ කොට කොදින්ගේ ෆූල් දණ්ඩේක මෙහොන්න umbilical cord blood නෝනේ අනේ ෆූල් දණ්ඩේක මෙහොන්න ලේ බේනකොගෙන් වෙස් ස්ටෙම් සෙල්ස් ඒ බනගා එම බයිකම් තහග අනේ කොජ්ජෙන් ඊතර කොරන්ජේ ෆර්වායෙන් ඔය දානති අදි ඒ කොජ්ජාගේ හයාතුන් ෆහම් වෙස් කොරන්ජේ ඊතර ෆර්වායෙන් ඔය දානති වේ බයිකම් තහග ෆූල් දණ්ඩි මේ එතනොන් එනගා ස්ටෙම් සෙල්ස් ත ඒ කොදින්ගේ මොලි ඔමර්ගස් රක්කා කොෆ බාට්ට.
And the third type is, if we have not stored the cord blood, then we of course have our own cells in our own body from our bone. You know that blood is formed every day. Where is it formed? In the bones. Like when you eat non-veg, when you chew the bone, you know that inside there is a fluid, and that's the bone marrow. Here, blood is formed every day. New blood is formed, and we take cells from the bone marrow. These are our own cells, and they have no problems or no side effects. So this becomes very safe type of cells.
දැන් තිම්වන ගතක ස්ටෙම් සෙල් මේ නගා ගොතකි අනේ අලවන්න මේගේ බෝන් මෙරොන් ඒ අනේ කෂිකණ්ඩෝගේ මදුගේ තෙරෙන් නගා නෙගොමේ අලවන්න මේගේ හෂිකණ්ඩෝගේ මෙහොන්න කෂිතෝගේ තෙරේග හකීගතක මේ ලේ මේ උපද්දනිය කිසක තෙදසිමියා කොදින්ගේ ලේ නෝපද්දනිය කි බෝන් මෙරේග හොන්න මස්සලේගේ සබබ ඒ ගොතන් හැම අනේ අපදොයි සම සෙල්ත අනේ ලේක අපද ආවමන්දාච්ච කොම්මෙද වහක එත බාවර එත ලක්ක සෙල්ද උපද්දමන්දාන ඒක තෙරෙමස් බෝන් මෙරෝ මේ ස්ටෙම් සෙල් නෙගිදාන ඒ අනේ එම්මෙ රක්කාතරි ගොතකි ස්ටෙම් සෙල් නගා ආසකෝ මේ කොච්චාගේ ෆෝල් දණ්ඩින් නගා ස්ටෙම් සෙල් රක්කා කොෆ නෙතියාමු දෙන් අනේ ස්ටෙම් සෙල් නෙගේනේ හැමකෙනි ගොතක විස් මියොන්නනි මිගොයි.
So embryonic stem cells currently cannot be used for treatment because one, ethically, there in some religion, there is the objection that you are killing an embryo. So human right ethical issues. And number two, there is a potential or possibility of forming tumors. So embryonic stem cells are good for research, but not to be used for treatment.
දැන් ෆොරතමගොයි ඒ එම්බ්‍රියෝ එකක් නග ස්ටෙම් සෙල් ආනේ එවිස් ෆර්වා එක බේනමෙන් නොකරේ ඒ බයි දීන්ත හොගවිස් හිදාෆ්තකෙන් හොන්නා තිබෙ මිසල් දක ආනේ මේ බිහෙ ආනේ මාරාදාගෙන නැති ස්ටෙම් සෙල් නගාගෙන බේන කරන එක හදා බයි කාලකන්තම් උරුමා දෙගේ ගිතුරුන් ආනේ බයි ෆාරෙන් එම්බ්‍රියෝ නග ස්ටෙම් සෙල් බේනකොක්ගෙන් ෆර්වා එක ෆියාමුන් එබා ආදේ ෆහුන් ටියුමර් ඔෆෙදුන් කාලේ කාලා මස්සල්තන් එහෙම ඒ එම්බ්‍රියෝ ගේ ස්ටෙම් සෙල් බේනමෙන් නොකරේ ෆර්වා එක.
But we can definitely use cells from our own bone marrow because we are not killing an embryo. There are no long-term side effects and absolutely safe. So at Neurogen, we use cells from our own bone marrow to treat our own body problems.
එහෙම බානේ නියුරෝජන් ඉන්ස්ටිටියුට් මේ බේනන් කරන්නේ අනේ කෂී තෙරෙන් මිනග ස්ටෙම් සෙල් hama gamus egota stem cell negumaki eves dinega hilaf ufedi fonna kamenno den asako ane egota naga stem cell benon kokgen farwa korima mi tumor ufedon kahala eves masale adi mihatana fahal korefenne.
So at Neurogen, as I said, we use adult stem cells from bone marrow because they are safe, no tumor formation, no rejection. It is our own cells, so no rejection, no side effects, easily obtainable using very thin needle, no surgery, no cut required, no ethical issues. We are not killing an embryo.
Me institute me stem cell got beno kora minagani ane alano bone marrow ga mi honna stem cell ei ane sababaki ei war rakkatere gotakawati ve dewanakama stem cell beno kokgen pura farwatakun tumor ofedumuge fursatu nonna tive den ane anekamaki hashigando sel bala ganna tive ei saka alugando me alugando farwa koranya hama alugando ge bone marrow ge sel na ganiyaki ehemma ane hashigando e kabul nokurumuge chance nove den hatarwanakamaki war fase hanaga evs surgery hada kanna jehe hama me amko me spinal fluid hama naga gotan injection ako hima katten injection ako naganiyaki then
so what is the scientific basis of the work that we do at Neurogen? We have done a lot of studies for last 14 years and we have 106 publications, scientific publications in peer-reviewed journal. What does that mean? In different scientific journals, not in newspapers, in scientific journals. So 16 of papers from autism and first in the world that we showed that in autism stem cell works. So we have a lot of work that we have done in terms of research.
Obahe ane mikamuga scientific barudanaki egota balaro mi Neurogen no miharwanni sateka ha scientific study ane eki journal takoga mi shayar kofa mi ane journal laki misalaka mi ane nosta kahalechenno nosta ko mi onnaniyaki mi reporter ko beenon ecche comment ecche ko fenigin lion kahala kam ekama ko mi hama bodati academic hama journal takoga ebe fulun ane mi kankama behegoton shayar kofa hori mi research ta.
So we also have written book chapters in various international books on stem cell therapy in autism.
Then hama egota ane mi team wani ane eta hama ane bodati foittakoge mi stem cell therapy abe hegoton eta chapter lefa e foittakoge awtan ane be from request korima ekama be hegoton me be from me open.
So we have written many books about chapters in cerebral palsy and other physical developmental issues. Thus, this is Dr. Alok Sharma, our director, Professor Alok Sharma, giving the book that we have written on stem cell therapy in neurological disorder to our Prime Minister, Shri Narendra Modi.
Me photo anti fendi wada gannawanne ane team ge director Dr. Alok Sharma ane India ge board wazir Narendra Modi me stem cell me research taka begoton lefa fote me adiya korwa manga.
So how is the treatment done? Let us look at how the treatment is done. Treatment is done in a very simple way. There is no cut, there is no stitches. One needle in the hip bone marrow is aspirated. Okay, then stem cells are separated in the laboratory and then injected into the lower back in the spinal fluid. So not in the spinal cord, but in the spinal fluid.
mi farwa kura gota behegoto badalama hinga furatama mi stem cell nagani mi bone marrow neguma fa laboratory ane e fluidum wahikorani stem cell ta wahikoruma fa hama ane inject mi korani spinal fluid ge theria hama ekani stem cell ta wahikore for stem cell ta.
So this is in a simple way, no cut, no stitches, no long-term side effects, very simple procedure.
Mikan korakan eves operation en nokorane eves tane fahaka vis nojehene hama ekarni hama injection ne jahagen hama laboratory ka lene gon kala bataka mi farwa kurietan.
So let us now go to autism. What is autism?
Hinga badalama autism maki kobata.
Autism is a neurodevelopmental disorder. What does it mean? That when the brain is developing, there is something wrong. Something doesn't develop properly, due to which there is problems seen in the children as they are growing.
Autism maki neurodevelopmental disorder em harigon sekundige ane narabe nizam neurological nizam emme rangala foriya monwane hedi bodowen anneru.
It is seen in the first 3 years of life, or detected in the first 3 years of life, and it can be mild, moderate, or severe.
Me kujjaga amarum furatama tinharterega autism hunna kujjekkan wata nonkan eba deneganeve den autism ge eki level tan eba hore misalaka ankole dakkon autism hore fan noni meduminege hore fan noni hama wara bodavis autism ge asar hore fan.
It is seen 4 times more in boys than in girls.
Firihen kodin kibaga me autism ge masada ginakama faha koreve ei komme ei ane anhe kodina wore hataru guna itora firihen kodinna autism ge asar kore.
So we can see here that the number of children with autism is increasing day by day. You can see the graph here. Earlier in 2004, it was 1 in 166. Now in 2020, it is 1 in 54. So the number is increasing.
Me America ga autistic kodin ofan wawaro me harfenige me dani furatama ane me nani komme sateka fastola sakojje kon ekojje ekama 2020 men aero deha hoge komme sateka fastola sa kon ekojje namas 2020 men aero komme fansa satar kojje kon ekojje ka mehri autism ga asar kofa.
So 70 million people in the world are on the spectrum or are diagnosed with autism. So 1% of the world's population.
Dunia ga abadige 1% autism ge spectrum ge commerce ware ge baliga ulena kam mi belevene ga ayanta ka haidde hora kam million mi.
So what is the main problem? We all are going through this. We know main 3 problem: poor social interaction, impaired communication, and same behavior, rigid behavior, repetitive behavior.
Me autism ga boda me autism honna kodinna hama wara undagowane me igitimai gotum mi honna golunta gaam koran den e gitoron ehem mi honna muamalat koramis waran undagowe den e gitoron hama ne abadu repeat ko ekkamek koron ek gotakan hedon ekahala sifatakin fenigen de kudin kiba.
So what is new in autism, in treatment of our understanding of autism, is when we understand autism better, what is happening in the brain. And of course, the second thing is stem cell therapy and integrative therapy. These are newer treatments now available.
Emane autism farwa hoda eros e bajje wara bodon autism maki kobakan engen kiwegen kan autism mi hunnani kodinge ema mi farwa hoda eros me boda belewunu kama kiyei.
So we now know that we do this PET scan. You can see PET scan of the brain. You can see here, when you see brain, this blue part here, the light blue and dark blue part are the damaged part. This blue part is the area which is causing the autism.
Me PET scan badalli me bafene no kulaga inna bay sekundiga e ba kama me hoduni me ekamuge sababon kama autism me kodinna me autism ge undago kodinna me honnani.
So this is, we have published again in the World Journal of Nuclear Medicine, what is wrong in the brain of a child with autism.
Maybe from me publish of a World Journal of Nuclear Medicine kya journal like me study me ane alama yebafene autism honna kodinge sekundi PET scan no eba fene no kulage bay kaloko nokon inna bay autism hunna minwarakon ekodinge ehmane mibe fulon mi hodi hodumaki kodinna autism jehe sabab noni autism ge asaro ekodinna pura sabab denagaton.
There are different kinds of treatments together. They work in autism. We have, of course, all therapies are there, but now stem cell therapy, now oxygen therapy, biomedical treatment, all together work as a team for treating autism.
Me wetwedi diha aharo me befulon autism ge kodinna farwa dinumoge tere me befulon me haro ane gam kore hore eki kahada therapy tam sa speech therapy physiotherapy hengo aquatic therapy ekahada eki therapy ta de wahaka me befulon fahagami korawa hasako stem cell therapy.
The second part is neuro rehabilitation. Many of you are already undergoing neuro rehabilitation, and in Neurogen we do a combination. We do stem cell and then we do neuro rehabilitation. I will just name the different therapies that are done in Neurogen.
Me Neurogen centroga me stem cell therapy ekkon adi egi ituro ane neuro rehabilitation therapy ta vise badeve e hasaka stem cell therapy dinama fahu ane therapy ge ane effectiveness rangal korumattaka.
So we have psychological or applied behavioral analysis, ABA therapy. Then there is physiotherapy. Then there is occupational therapy. Then you have sensory integration therapy. I think this parents know already. Speech therapy and aquatic therapy, exercise in water. Art therapy. So these treatments are done in Neurogen. I think this is self-explanatory. Yeah. And then there are different treatments that people do elsewhere. We don't do removal of heavy metals, but many people do undergo this, giving supplements, vitamins. Okay, I think many people do biomedical treatment. Diet is very important. I think Mr. Mohammed Akram, you can explain about the diet here. So diet, we generally, for autism, is recommended to give gluten-free, casein-free, meaning try and avoid wheat and avoid sugar and avoid milk-based products so that gut or the problem, digestion problem improves. So child can pay better attention.
Koin Dr. Dakkawa devi ane amko hama ane Neurogen ga de by farwata egoton speech therapy adi eki kahada occupational therapy adi egitorong aquatic therapy adi hengos egitorong ane diet based by kahada diet and nutrition based by kahada therapy ta seba devi egoton autistic ko dinna war boda mi fahako fami onnani ane gluten free diet ane hakura den kiruge bawaitan nohimana diet dinuma. Mitano deme dakkawa devi by kanata demvi kanaya no demvi kanaya.
So let us now look at what are the results of stem cell therapy in autism. We have treated over 4,000 patients, and by and large we see 90% success rate broadly in autism. So 90% of the children or individuals who are treated show improvement. 25% show mild improvement, 30% show moderate improvement, and the rest 30% show good improvement.
Me table no me fene lavani me Neurogen ga ane farwading haisateka bali mi hange tereng negifawa ane data e data dakka gotuga ane 90% gaigandaka 90% kodinna commerce pari ane improvement en asi mani rangalo men asi 30% kodinna evs improvement en naannani ege tereng meduminuge ane rangalo me fenijje 56% kodinge den 90% kodinna meduminuge ane rangalo me asi ane bali recovery en asi adi egitoron me 33.7% kodinge me autistic massadam wara boda rangalo vecche.
So what kind of improvements are seen? What we see generally is hyperactivity reduces, eye contact improves, attention concentration, sitting tolerance improves, understanding improves, learning improves, following commands, and then socialization and speech. So slowly you see that after stem cell therapy, the therapies that you do, they become more responsive, child understands better.
mihar mitable no feni midawani ekudinnan ane improvement ge baavet misalaka ane eye contact rangal vejje 67% mi samal kan dinam rangal vejje 63%. then ma bada helifeli wole ko din hyperactive ko dinge ekan dakkori vejje 70%. then hama egota eki kahal amsalaka behavioral pattern noniyamu wahaka dekkumuge masala hallu kore hem income minnani 56%. egota egotun ekodina asori improvements.
So this the first ever publication or scientific proof that stem cell works in autism has been published by Neurogen in 2013. So long time back we published and we showed that stem cell therapy works for autism in international journal known as Stem Cell International.
Me stem cell therapy ge sababun kodin me autistic kodinna farwa libe kamuge hekka ekko me foratama journal le noni liume me share kori India ge doctor ko ei dehas therawana haro.
So apart from showing that the child improves, we also showed objective changes in the brain. You can see the brain functioning here. You can see the blue areas, the blue and dark blue areas here before the treatment, and 6 months later, you can see that the blue area has reduced and green has increased. So that means the brain is becoming more active, more positive. And so there is changes inside the brain and outside also you see improvements in the child.
Miss Keno feni tidawani foratama ane matiga hori photo takaki ane mi farwa dinamu e kuring naga fori photo ta sekundige then tiriga mihiri pet scan photo takaki farwa fahu hamas duhoge fahu naga fori photo ta ane matiga hori photo takon no kudage bayen eba fene nonto sekundige ekama ko tiriga hori photo takon mewani kuda waraboda fando efa eka mane ki mi farwa ge sababon sekundiya eba farwa dibigende එහෙම මියා එක්ක අනේ ඒ ලිබේ ෆරෝ සිකොන්ඩියෙන් යන්න බදල්ලා එක්ක හැම කුච්චාගේ ඔලොමක් වෙස් අදි කුච්චාගේ මේ behaviors බදලන්න මන්දාන.
You can see that these changes. So this is objective changes in the brain. Another publication recently in 2020 where we showed result in 254 patients. We saw very good improvements in all different areas like social interaction, eye contact, attention concentration improved, aggressiveness reduced, hyperactivity reduced, sitting tolerance improved, command following improved, speech improved, communication improved. So this is more recent data.
Fahoge hodan takmas me fennani hama mi duista panza satar project ge data nagage hada fen researchers me fennani hama ane rangal waraboda improve hoti bitan kodin egotun social instruction improve vecche ane eye contact rangal vecche mi samal kan dino rangal vecche then egotun hama eki behavior ta hama miri rangal wako me dakkani research tak.
We also see what we most important that we see is that age of the child is very important. That earlier we treat better the results. So when we treat children less than 5 years, we see 98% success rate, and between 5 to 10 years, 94%. So age is very important. Earlier you treat better the results.
Then me studies ta konves emme boda faha korave kama ki ade befona ade farwa emme boda faha korave kama ki me kodinge umuru farwage me outcome para boda gulifawa kan ane salaka fasaharon dashuga me farwa ko dinna kore vidya anwadi 1% kodin eba ane rangaluwe adi fasahara dihara demedo vejja anwadi 1% kodin adi dihara fanarahara demedo vejja anwadi 1% kodin adi fanarahara pore ane kojjage moro mati yama anwadi 1% kodinna improvement mena.
So these are that first time ever in the world, first time India published a paper, after that China, after that Italy, then USA. So USA is much behind India and China in this field. That's what I want to show.
Me slide me dakka deni ane paper ta publish ko fori goy saka emme forta me kama gole paper me publish kori India and for China then Italy then America ya megens me fennani India ya China ya wore ma fahatage America me olani me kama stem cell la begotan kora dirasata.
So these are all our publications, scientific publication, which shows the work or the experience that we have in autism. So now I would like to, of course, share some videos and some experiences of parents and patients who have shown improvement. Before I go ahead, I would like to invite two of our patients' parents who would like to, I think, discuss or show their, share their experience. Mr. Adam Fazil, Mohammed Adam, yeah, Mohammed. So I can't see that name. Mr. Mohammed Adam, he's the father, is that? I think two parents. Can you raise your hand, Adam's father, so that I can identify you? Adam Fazil's father, can you raise your hand? Yeah, yeah. Mr. Mohammed Adam. Yeah, so I'm going to unmute you, Mr. Mohammed Adam. Yeah, welcome, Mr. Mohammed Adam. You can unmute yourself. Back to the job. Have you been able to unmute yourself? Okay. Do you know how to unmute yourself, Mr. Mohammed Adam? No, allow to kiya na maine. Huh. Sorry. You can speak now.
Can you hear me now?
Yes, yes, yes. Yes,
Okay.
yes. Welcome, welcome. How are you?
Yeah, I'm fine. And
Good evening.
actually, I just want to share some experience regarding this thing. So, most of the thing is that already that the person who has given the translation of the your speech. Yeah, I think most of the things that he has covered. But actually, I will share my experience in the way. Assalamu alaikum. Uriya befornas arbad marhaba de mi Neurogen mi team alwanda devi mi invitation alwan gabol ko de alwan ge schedule horigatu mara daw gadiya kami bani kami salwan ane share kollan alwan darya mi stems eduma fahu mi improvement ta de maganu gatte hama mi slide ta hoga mi heri hama ega ane me fenifavori hama gina kanta misala kabbanama ujjaga behavior furatama and behavior issue nangalugen dia then eye contact then me kevman as then writing skills then ege itara me by kala kanta understand and sangole ane me ane kurierunga then sensory issues the mihar alwanda benuma vara sensory issues the nudiakamuga vias alwanda mesegen paha kore bakan misala kabnana mihar salwanda hama emme bodo ane masle kabani ena ane mi bokasruma dangolu ma mikaha kantatte ki hama undaw kantatte kama kuriga vejja bokaram vejja hama alwanda hama dema ferin hama jehen hama ena gaga hama olula gandage mara undaguluga ekam kuranje de mihar by far alwanda ane mi bokara tanage ngossa ane mi phone nu kale chedigen ha mathir koggen ane kantatten ebe kore den dangolo kantatte kiwes mihar kuriga hama warang undago kame gotuga faha korana den mihar ekam ena amille wes try kore ena amille wes kantatte hama koramon mihar annani den arone kala mi count of misala kabana ena kariga burani diha far darful den gulashe gunima ena egota kawa kore den behavior kantatta galwanda faha korani misalaka kuriga vejja ena angeyan alla wara ama kulu tantano haka mane ada den kantatta ves mihar hama irad kuraja mara boda rangalu haden muliya kun rangalen nune nachi misalaka mihar sama angeyan alla ule ekam ei mane mara madu den jumping mihar ena kuriga bagoteki hama ekala excite wima ane abade stantana ngara fumma den berung anna mihaka ngene jump kuradan fenijja hama berung hama turturala gannane den alwanna hama fen den warang hama birues ganne den hama kujja hama mis gega sofa e gondiya mezen eccha hutta samega maccan arafa fummala hadar hama ges kaku ges jasa hada den ane hem balang hor mihaka warang udan eka mihar radu pejja ekantata rangalu efane den anikantawge mi ane screaming ena eka majawima warabboda hama adulava wegen hada ero den mihare bas warabboda kudawegen me den liumuge kanta misalaka writing skill ebonefia eroga ane stem hedumu kuriega ena mi kurahalen dinasa mule fansoro hama kaatan misalaka wan echega kulajasan dinas ama ane outside boundary ge sama ena ane jassana ekam fahun hame inside hame terega hame ben balagi hame ginafara ekula hame jassamba tantan hame kula jassafona den aslum mikahala ko dinga bike ko dinga wagotiki ane mi hunge mi atuge mi bar bar ane hunnani kanne ga den ane sponsor chi faro gesting ekantatta beseka miharo hama marabboda hama rangala fan den ane mi keumuga kantatta bes kuriga alwonna dari hama beenuka me deharo bamfere de bikanta engunesen baragi hama nuwa haru bande se ena hama mi alwonna mi dari ane furatam stem cell hedi ena gomburun anga haruga එදීරුග ස්වාගතක එන එක කෙම්මුග මිහුන්නනි හම වර හම මාදු එච්ච මිසාලක බනන්නම හැඳුණු සයන් එන බේනුම් කොරාණේ රොට්ටා මේ ගැරිකිර බේනුම් කොරාණේ එනු එච්චනස දෙන් රේගන් අද එහෙන් ගඩිගඩේ හම ගරුදියා බතානුවන් හෙබෙස්ටන හමුණුකාන එක මිහාරහ මරුවන්න ෆොරතම ස්ටෙම් සෙල් හෙදහම හදාගෙන් ඒ ෆොරතම ඒ වීගතර කව නිවරෝජන් ගහුරීරුග etanoga eta eteren furtama strike kori etano ane muguriha ya warang handang hore muguriha furtama na sama den feri etano ha wara den ege tora sendu chechi hadafa dinima senahama mi kamungai mi den alwanda fene improvement den ege tora mihar misala kabana ane ikantateki alwana hama deman fere mi mamma none bappa vestama ena ruliyaske misalaga ecce bonefias ena engena e ruliasken kan engena anika ege tora mihara deravejja ena asa e deravi kan ena enge bihsas korave ehema mi alwana dekone mi wes improvement den miharo mi kahala forum එක nune kahala kamen alwana share kolle wene madu kantatta gedde mihara be tigen be fala ko itora ha madu mata saf kollan beenu vejjiya alwana ngade mi ane hama share kolle deena mi den mi tame mi kura masakkata Nandini me kura masakkata hama alwana saden Alok Sharma hama gak wala wonna detere den devana sotakan alwana mi haddo mi hama gossa den adi mihara devana soto ane mi jehi pahun adi alwana kam mihar adi mi mabodo kurere me yakan adi mihar bunan adi tankol avas kannege adi hama mi doluma ses we afam ehmema eyaka den mihar mi befloin itora mihar integrated therapy ekya nami therapy en ane oxygen therapy mi taraf koggen den ege alwana hiwane eves den result rangalo echekkamuga ane mi alwanda faha kona den ega mihar mi alwanda faha koron ekkamedde mihar kudakudim vejja integrated therapy hada eroga mi ane mi waddani mi oxygen difa honna chamber ගෙතර මේ ලනි ලාර ෆොරතම වාවතකි ඒ අරවන්ඩස් ෆොරතම මේ අංගණුන් ame ane මේ chamber li kujjaya kiga ama bagotu eminent person ena teligana ja haswegene kiyana den alwanda ama pahun den alwandas biruga gambanna den kam Alok Sharma Nandini ame hoti habe fonong masara ke mi kujjataga mi komiska gurbane wanje hene kiya den nasehe dini malwas efara wani ekam ma bod masale kannoi defin den ega mi Alok Sharma ves alwanda mi nase dini komngade ek oxygen therapy ki integrated therapy ki rangalo echke ek ujjaya ki ga wanna mi ha ves ege ham rangalo faada take wada den alwanda spaha koran ekkamaki alwanda ane mi far India diero ga hori hama mi ham furdam furaga me kolon dieros atuge hori hama mi tadden hama walwa tadden hore hama ame ane mi kondom ferigen gos hama ane kuda ingi hama ingi ja hama mi tadu hama munko kon hori එක මෙරාද කො ජද මේ හෙදුම ෆාලුවන්න දෙ නේගතින් ඒක සබුන්හෙන් අලුවන්ට බොඩ අත්තරි අනේ මිහාර හදෙන් අලුවන ගන නෙයි දෙ මී ෆාහව කරන එමිහු එබැෆුණුග ආතෙටපීග පුරි දෙ අලුවන් මේ මෙවාහ කරුවන අංහරන සයන්න පුර එක මිහාර මේ අලුවන හම වර බොඩ ෆාහව කරන මීවස් රංගලු තෙරපියේ කමන් අලුවනු කනේ දැන් මේ මගතන් අලුවන සයා කොල්ලන් ඒනො මෙත ඉතුර හම මවද මාත බෙන් වජ්ජ හම අලුවන හම ගුලාලීම හම මේ එබ්බා අර්දන් දිහති වේෆොන්න මවද මාත එමුන්ගේ දාන මේ Nandini, I have explained some experience regarding these things. So I think this will be good.
Thank you so much, Mohammed Adam. You said a lot of things. I think somebody needs to translate it back to English for us. Anyway, I'm sure you have said all good things. Is Mohammed Shadan's father with you? Would he also like to speak? Mr. Mohammed Adam?
Yes.
Is Mohammed Shadan's father also with you? Mr. Adam Shafiq?
No. I will try to call him.
Yes, Mr. Mohammed Soba, I want you to speak. Yes, I was just checking. Yes, I will unmute, allow Mr. Mohammed Shoba to now speak. Isha's father, very experienced parent. Are you able to unmute yourself?
Yes, unmuted. Hello.
Hello, how are you?
Very good. First of all, I would like to thank you, your team, and Nandini ma'am, and Mr. Alok Sharma, and Neeta ma'am. You are arranging such a wonderful webinar program. So, iske liye बहुत शुक्रिया.
Thank you for attending. Always so supportive.
Then, can I share the screen?
Actually, the problem in this webinar is that only one person can be seen in the screen.
It's okay, thank you.
So only your voice will be heard.
Then, Miss Nandini, I will talk Devahi and English both language. Is it okay?
Sure. Yes.
Assalamu alaikum. Me program bayarwada na horiya pefulum. Walaikum salam gaden ni webs pefulum. Me algonda kiwes me satara har kurin pering algonda ke 17 years kuring algonda darfuluge me autism farwaya mase koramda ane parent ngeto then algonda embe fortama damferi listen kiya ane NGO eka FO care society ediya FO autism association ga me madam ilham geega hingi kulahuge first one registry kori parent algonda ki first then ekon budku the improvement annam asting algon tankole korea me stem cell therapy I have the kuring algon me geega wara boda me ki therapy ta korea gendiya me algon ganu da jaiko then egotum algon wara fa kore rajyaga tv modis un tayyar kori haashebini program ingeto parent me wara muhim program e haashebini program kya cd take tankulu kuri neregen dan e rajyaga mihatana nerunu emme effective nursery rhymes divehi me language ga divehi adwala nito em algon wara recommend kuram muriha parent unna bis hama early stage ga furutama kologa me waaka dekkuma adutan amuge undogu taklif ta hunna darivarum daring me haasheven program adwa ege wara bodu echen dividanaka malgona gabu ham games algonu ga darifula improvement amuga wara muhimmo role kolon haasheven program em algon huriha parent unna bis recommend kuram haasheven program ane kudinna ega hunnane sound hunnane e akuru hunnane ege environment engene etana gengo sekudina sound akura dakka ekon kurebe tibefune ngodanna amat aunty kiya befule mitan kurebe then dehas algon me ekegi therapy ta kutereng as stem cell therapy ahamen algon me naade uni dehas 11 ga Mr. Alok Sharma Raj Badagen ane me autism association Kuligen Gendia presentation program tereng algonda bes program ko baran fursat libunima then algon men ege mawdama hodam nas then algon men air financial condition hori gotum mege diungu fursat kudai matan kole mat kolle algon mistivi der den algon men commerce gota ko finance arrange wego bima algon men dehas nawara ga fratama diyai neto gossa dier sama bara me hyperkantat hodin hure dengi ki kankam mesre eros komisar ka wa ka dengi dakka dihas nawara punya si algon darful gun sada war ka handa sa
සාධාරණකම බලම 13 plus 14 years then program galgono men bare falgono men afrotama pet scan hadam veddi do hois wara takulif jehonu injection no jehuma iv no jehuma me eka kankama idukol hedum den fungus teki veggotun hamato kogen algono men me ane mri hada iv hada den plus me pet scan algono men na result dakkale algono medu tibe for na experience yakon nodeveti waratere algono katuge bahuri me ogotu me x-ray ge kala copy ta ngeto copy talgon me hutang share skoldan ko me zoom program ga screen share kuren wenne tema is very very sad inge de ehem pahara ko algon share kurun fursate bejja al share den ane ega hamba significant improvement eba hore asa dehas nawara ga algon men me heri stem cell therapy dehas nawara hada algon men me pandemic ge undagula hedi algon men me review hamas pohun review devego tenu ehma algon mena e review mi deuni dehas vihiga dehas visse besnu dehas ekavihuge december algon mena mi deuni december gana ko funds vi satan algon devuni e algon muhammad adam demme wah dekke muhammad adam danish bappa adam shafiq algon men team family ekko mi december go diyes so then em algon me gossa e review gossa pet scan hada algon mena me nandani memma ane huriha mi therapist unge mi team mi kan kura team hama bodu improvement as hori kamuge x-ray algon menna dekki algon menna demme nandani memge explanation e presentation ga e fa kore for the blue area eka green area eka mind ga ehunda ane huriha tanin e fenegen da diuntere algon menge mi dar fluge fa kore pahori hama wara bodu improvement as hori ka adi mi algon fa kollan dehas nawara ga mi hadafa algon men 2019 ga algon men mi stem cell therapy hadafa den mi 2 years terega dar fluge behavior sha wahag dekmasha visnuma
I think we lost
hello
Sabha.
yeah
thank you so much for your beautiful talk. Some of the things we understood, but
hello
hello yeah are you there?
Yes, I'm there. My voice is
yeah.
Are you getting my voice?
Yeah, now there was briefly it was not there, so now it is there. Yes.
No. So then me alone darifulu me faha kuram muni warbodu improvement tere emme fahum me ane fahum ane me stem cell ademu kuri algon darifulu as vistumanga badalega waha hundakkane darfu mamma karega darifulu burani mammae ane dar timanna stem cell therapy ge devana shotang india adda lari arrange kuri vijhe me wara bodu hama wara kike tanwan hama wara visnun tun intelligence kujjak gunakala wahakenge de algun waram ama surprise with algun bonin darfu karige darfu devego ta meet range kurevena irat kore finances hamaje hena kya algun me hisa masik peri algun ha parent una dannawalam me asanda nota me rajyaga me unane asanda nuni enspa tere me har kommes gota ko miyan ehi dimu fursat be so enspa me hama help dimu fursat wara podu ngeto parent me tibe for na alon hama danno al mi far alon me mikama try kogen adimage moti fenifa den hama ane ibuna ane secondary ge ibuna blue area and green area ya badalu muga hama wara bodu improvement so it's very impressive irat den algon hama ane message ki ane mi kama for the parent you have to think very positive wisdom angulase it will be okay miga ana irat korabia ana darivaraka darifulaka hamwaka nota dangerous ebiskal miga nuhinge hama huriha kame sangala anikolum mi therapy deba ana doctorum ana narhum ana speech therapist ana elkiyeki therapy ta deba they are doing excellent job nge negative ko nuis don't be negative fortama parent me rangala negative ko nuisna positive ko visna afia mige hama faada kurane mi bunye kiun badalu hama sida ane neurogen na contact korba hama sida malumati me hazin teliboda annevi ema algonuge recommendation ki ti parent unna mekamuge isnamgaage masake korabwase result edduwa kunnana one day ko result enana ema you have to be patient. One day you will be happy, definitely. Thank you very much.
Thank you so much, Mr. Mohammed Shubha. Like always, very, as you say, he says, be positive. He is one very positive father, I think, very inspirational. Now, I would like to invite Mr. Adam Shafiq, father of Mohammed Shadan. I'm going to allow you to speak. Please kindly unmute yourself. No, yeah, sorry. Yeah, Mr. Adam Shafiq? Yeah, I think, yeah, you've unmuted yourself, right? Yes, do you want to share your thoughts, Feriji? Are you able to unmute yourself? Yeah. Mr. Adam Shafiq, you can unmute yourself? Yeah, I think it's, yeah. Welcome, you can now, yeah. Yeah, you can now share your experience and whatever message you want to give to the parents in Maldives. Mr. Adam Shafiq?
Yes.
Yes.
Can you hear my voice?
Yes. We can hear you. Thank you.
Okay, I wonder they want to short me her around the full jag me already. The full me her come fanara har me gag. Me tingar kuing furtam sort je. Dini. The full was me stem cell therapy ya me maulumat mearing de malia sun monieg maulumat dibuni dibigeng deng yega ko bajar se mati ere bore bodeng ek fad wahaka ya mere dekaveti adi haasako medical doctor unge fara tum ya ma nongote gwa gonna ti boda undogwani mi amille decide kurum seide medically emi hun me angolo maulumat denti baiki se kama emi hunge fara tum ha positive ko nodakka angolo undogwe furtama koluga decide kurum da kama gusden mi kahale kudinna devene anek kahada farwai den hen tigen farwai ka wa ka farwai nguleti ule kama hi lafa korveti mi kama den mi set ko ida den gos kom yagas ekolo gaden wara rangala diyei den ham pertama sodu digen as tanu ka gota den engem farab himan farab den eru ule ulum ga hada boli kama nani dimai kanda takabure rangalu ka marabbuduta agunas meena kudairuga hama ekgodakas game beras nonere unoni ekgodaka mathir nuati hama control nuati ya taaka danna bike ge gebes timage mi hegge diye sama bokitan nebuma dilluma fanga johuma nebuma den ekgodaka sama anehin control wa gotaka no ole ne kemima ne mara ladugonnati ya seku danna mi he sida timage mi huntere danna mi he kare noni os kende doma fo wara borta rawlegen improve angolwen as har den hamel yankim sengene me bahum singres bahum sengene den arabi ga de bole ko wanda ko le kam has fil jah kiyange kam ko de bahum gres bahum mi har hama liang kiyanga ho rangolan ge den de kun sawlo de mina ga de hore hen bah de ko kujja sabi ma lairuga dati hore kama hadi kuna awatu godin naki bahade kon dile fa bayek baati bes bahade kun ga huna dati kame hore ko mi har ko hamara normal ha mi har anin hen nege ni hen ole ulmegga hama mizatu kujje kes nubuna nas ha bes anin hen mi har bas huma yetre gole ulumugas mi har kodagas mi halani kame mi har kunen ekgoto em marabbodu improvement engene kamal belewe furtama suta gulige den දෙවන සොටුද මෙතන මෙත කොවිඩ් යම කොට කොල්ල ලස්සගෙන් දැන් කොවිඩ් යම් හැම එම්මේ වහ දෙවන කොට අනේ කැමස් දායි මාතියාසක දැන් අම දැන් මේ වාහ දෙක සබාමෙන් මොහම්මද් වෙන් මම එක්කොන් ගහ කොට එක්කො මේ දෙවුනේ අනේ මෙන්නකි අනේ හෙන් ඔෆියක මාහලක සෙක්කොන් වල බැයිවීම සෙකු එක්කො මේ දෙවුනේ ෆාරුද දෙසැම්බර් ඔගස් දෙවන සොටු ජාමයි දැන් මිහුන්ගේ ෆරාතුන් හැම වර රංගල මේ අවුලම අතාචිස් ලිබේ දැන් මිහුන්ගේ එවස් ෆෝස් නුනේ කොම් කුරුම කොම් මෙහෙ මජ්බුර් කුරුම ගනෝනි කොම්ස් කොද්දෙන් වකි අනේ හෙන් ඉතුරු කන්දතක මේ මජ්බුර් කුරුම කා ඒකාකට ගන්න හොරේ ආරම්න වරබල දූකොල්ලා හොන්නනේ බේන මවද මාතෙන් අමිල්ලෙන් හොදාගෙන අමිල්ලේ ඩිසයිඩ් කොගෙන් අන්න දැන් හැම දෙගොතුන් මේ දුනියේ ගෙහෙන් දන්තන බලා බලාර එමේ අගයකොස් දෙවෙන් අන්නනේ මුම්බයින් කවවීන් මේ මිහුන් යාල් කොගෙන් දෙවොන් අමියයි දැන් ලෆා කරවෙන්නේ හැම රංගලකම වරුන්නස් දැන් හැම බඩවෙන් ඔති නිවාවතු කුජ්ජක කුඩයරුගේ වි වෙන්ගොලන් යහොනු ඉඳගු හාලතම එක්කුම් ගොස්සේ මෙහි අව එක්කුම් ගොස්සේ මේ දැන් හැම බයිජක මෙඩිකලි බේස් කොගෙන් සෝ ලිබෙමුන්දා සේ කමින් හැම මේ ස්ටෙම් සෙල් තෙරපි අප ලිබේ දැන් අදි රාජ්‍යම වාගතකි ස්ටෙම් සෙල් තෙරපි එන්නදීගෙන් නුම් මේ විවාහතු කුදිමොනි රඟලුවනි ඔකියුපේෂනල් තෙරපි යා දැන් මියා ගුලේ එහෙන් හුරියා තෙරපි තකෙන් අස්තු මේක මොහිම ඒ බෑතන් අදීස් රාජ්‍ය ඔමෆ ලිබේල රාජ්‍යක නැති නොනි ලිබෙන් හොන තන්ත සුන්දගුවේෆ අගබොඩ වේම මේ ඉම්ප්‍රූව් වාම්වා වරකන් අස්තු මේ මාහෝල රාජ්‍ය නැති ට්‍රීට්මන්ට් දෙවෙන්නේ නැතිම බඩන් අදීස් සුන්දගුවනි එහෙනුන්න මේ වරවස් මාබඩ රඟලු විස්කම ලබා කරවෙනි දැන් අවුන්නකි මේ autism center of the insurance hetana hama furtama ilham madam mengega feri rugas hetana hama furtama join kuri mi hungtere mi de yer ferega meda hames continue makura de hena stem cell therapy ya mi hum se ha bodaka gayan webe danu kanege ekantu tedem mi har adis concerning hama mi den mi ole hen emmen mi treatment ta gayanu duruga ole golun ei denne kinen wa kam ekam බෑතක සාෆනෝ යදිකම අර මේ තජරිබා කුරිමි හුන්නගේ තජරිබා බලයාරුග මේ කමනු හබ මේක ගෝස් කමන වෙන්නේ යදි අනුක ගාමස් නොෆෙන එකම මේක රංගලොකත් බෑවර බෆනේ මෙහාර මේ අනුන්දර ෆුල් ෆරාතුන් අන්න හොරියා හොඳ කාලකටක මෙන්ගුණ බ හොරියා හොඳ ගුල මස්නේ හුන් හොරියා කම කහකටක මෙහාර හම වර රංගලේ බොලුවෙන් මෙහාර හම එබැතන් හැම හඳාමස් මනි දාගහල එහා බොරස් ලුයික මිහාර මොනේ ඒ දේ ගොන් දන්නවා
Thank you so much, Mr. Adam Shafiq, and I am thankful to all the three parents for coming and sharing their experiences. It is important for parents to hear from other parents that this is something new, and people are going to different countries to for their children, and that they are going to some place which is reliable and where doctors will take care of their children. So at Neurogen we consider the patients as our family. So I brought them in here in between the presentation to share the experience because they had some meetings to attend to. I still have 10 minutes more to explain on integrative therapies. So I would request Mr. Mohammed Kuram to again come back for the translation. Thank you, everyone. So going ahead with the webinar presentation, the third part of the webinar is on integrative therapies, and I think Mr. Mohammed Adam also explained a bit about oxygen therapy, his experiences. So I'm going to talk about the scientific part of it.
Okay, presentation ga miha hisaban den integrated therapies taka begato malumat evvan.
So integrative therapies basically is addition to stem cell and rehabilitation. We are adding on other treatments which will improve the effectiveness of the stem cell treatments. So this is increased by causing increased oxygenation in the body.
මේ ඉන්ටග්‍රේටඩ් තෙරපිස්ට බේනුමකි මේ ස්ටෙම් සෙල් තෙරපිය ආදී ඉතුරු ආනේ මේ දෙවේ ඉතුරු තෙරපිත හොගේ ඉතුර දෙවේ තෙරපිය මේ දැන් මේක එමෙ බඩු බේනුමකි මේ ස්ටෙම් සෙල් තෙරපියගේ ඉෆෙක්ටිව්නෙස් රංගල කරු.
So the major components is hyperbaric oxygen therapy, ozone therapy, gut cleansing, acupressure or deep tissue mobilization, and in adults, intravenous vitamins and micronutrients.
The integrated therapies hyperbaric oxygen therapy, ozone therapy, gut cleansing, then acupressure and deep tissue mobilization therapy. Then IV vitamins, micronutrients,
So so in integrative therapies at Neurogen and Neurogen Annex, hyperbaric oxygen therapy. So this is, you can see a chamber. This is a chamber where the patient or the child with the parent can lie down very comfortably. And in this chamber, 100% oxygen, medical oxygen is introduced and slowly pressure is increased. So they can breathe 100% oxygen at slowly increased pressure. So this is what happens in this chamber. The child is very comfortable and lies down and watches. You can see on the television, there is all this, whatever they want to play, sometimes cartoons, sometimes songs can be played on this television, and they're very comfortable lying and breathing 100% oxygen.
Hyperbaric oxygen therapy, me therapy ga ane kujya adi parent ka ekko me chamber ge tere dani and chamber ge tere ga unnane oxygen 100% oga then a medical oxygen for kommi deni eki mege beenuma ki ama we has bodaka oxygen for ko dinam hashigando ge horiya wataka.
So what happens here? Okay, normally when we breathe oxygen from air, it is only 20% oxygen, and this 20% oxygen, when we breathe, it goes only into the red blood cells. You can see the red blood cells here and oxygen inside. So in hyperbaric oxygen, when more oxygen, 100% is introduced in the body, in increased pressure, you can see that oxygen here goes not only in the red cells of the blood, but also in the fluid, in the plasma. So you can see more oxygenation. So a lot of oxygen in the body. So oxygen from hair to toe, all the whole body is flushed with oxygen.
Me amko algon me neval dima me amko me neval da vaga oxygen me hunne 21% oga then එහෙම මේ වගතකි අල්ගොන මේ neval dima ane hashigandog me hunna lege terega me hunna red blood cell taka ekani oxygen me dama gannani ekamaka me gota 100% oxygen difa adi pressure increase ko fonna maholaka lage me deve therapy ga me wagotaki molli hashigandoge horiha bataka hasako lege visama horiha bataka eba oxygen libbade.
So what does it mean? So we know that oxygen is the one of the main gas or the main chemical or main atom which helps in healing. We call it it is elixir. So this healing process is enhanced, is made better with the hyperbaric oxygen therapy.
Oxygen naki hashigandoge horihakamaka viseme muhimma ekeccha vairo mi tane faru gande etane rangaluwa healing process ane waraboda magfai koddene megota oxygen dibane.
So what happens, what are the benefits? One, that increases immunity, body resistant power increases, it stimulates oxygenation in the body, improves the metabolism, energy level increases, your tiredness or fatigue reduces, overall functioning improves, and stem cells in our body also get stimulated.
Me stem cell therapy fahaga me farwa me deve emme bodu esawaki me mikamage sawbon aharmenge hashigandoga me immunity eba definism warga deba kodde rangalo eba kodde den anekka me hashigandoga metabolism eba rangalo ve me giteron energy rangalo eba kodde adi warbadiwama ekal kantan eba rangalo kodde me giteron me stem cell itora growma mikamage sawbon eba mogfai kodde.
The other part of the integrative therapy where we increase oxygenation is the ozone therapy. Okay, so in ozone therapy, what happens? Normal oxygen is 2 molecules of oxygen, O2. So in medical oxygen in the cylinders, there is oxygen is O2. Now this O2 is passed through a machine known as an ozonator, and we get O3. O3 is an unstable and but highly active form of oxygen.
Ozone therapy then me ati ozone therapy ga mideni O3 ei algon men nevala me oxygen ga mi honnani ki oxygen ga de molecule ekamako ane itura e cultivate koggen mi de oxygen ga mi nani tim molecule mi wara me active
Yes, active form of oxygen.
arm oxygen navare ma bada harakaitere active oxygen nemme.
Yeah. So this activated oxygen is very powerful. When you introduce it into the body, it can kill virus, bacteria, or fungal infections. Okay, then it reduces swelling in the body. It thins out the blood, prevents clot formation, acts as an antioxidant. So it has multiple action, also stimulates again the stem cells in our body.
Me hashiganduge stem cell ta me deve farwa me deve stem cell ta improve korumuge itoran ane me oxygen therapy ge sababun virus taka bacteria taka hadi fungal infection ta seba marala me ge itoran ane tafatataruge dola taka ekala kanta seba dakkodde adi me hashiganduga lega terega me ufiti hunna clots ta eba ane nattalde adi me ge itoran antioxidant ge gotaga me haraka termi wani.
So this is the different ways that oxygen, ozone can be given. Can be given like a sauna. You can sit in this place and your neck is out and like a sauna. This is the ozonator. It can be breath. You can, like a steam, you can take through the oil, or you can put it into your blood, or you can give from the rectum like an enema. So different ways that ozone can be introduced into the body.
mi fototako mi fennani ozone therapy devidaneki go itta eggotaki mi kanu mati waki gotaka bandoko gen deve therapy gotaka den noniyamu hama steam inhalation gota inhale kora gota noniyamu mi pragas faratu hama mi deve enema gotaka sama edi inject kore vidan.
So we can also there is gut cleansing through enemas. Gut can be cleansed even through ozone. Gut can be cleansed in autism. It's very important. It improves the immunity, the gut cleansing on the ozone.
Mi terega hama mi farwage tereng hama mi anna ekkamaki mi hashiganduge mi gut cleansing onia bona kama vanya mi bodugohoro saaf korum ekamge sababum ves hashiganduge immunity rangalwe adi mi autistic ko dinna ekamge sababum itro faadata ke dibigende.
The other thing is acupressure, where different pressure points are pressed. Again, that helps to relax the body, relax the child, reduce hyperactivity, as well as improve oxygenation in the body by giving acupressure or deep tissue mobilization.
Demi therapy ki acupressure therapy mi therapy ga hashiganduge eki pressure point taka mi therapy amazo ge medani den mikam ge sababun itara relax we hamajehi adi hyperactive kodin ge activity dakkoruma mikam sababun ehi terivede.
So these are different techniques for integrative therapy for autism. At Neurogen, and we have a combination of stem cell rehabilitation and integrative therapies. As I explained, these treatments are simple, they are safe, there are no long-term side effects as a part of this treatment.
Me Neurogen me autistic ko dinna deve ekiki farwata den mi farwata e sababun ane long ane digu muddataka dimawa sihi masaltake paage kore fenne.
So we have with us today Dr. Alok Sharma, who would also like to address you, talk to you, say hello. I'm just trying to unmute him. Sir, can you unmute yourself? Kindly unmute yourself, sir. He's not here. He's logged in. Okay, so he will be reaching shortly. In the meantime, I will finish. So over 11,000 patients treated from 70 different countries. People come from all over the world to us. Okay, Mr. Mohammed Akram.
Sorry.
Yeah. So sorry, the Dr. Sharma is here, so I was trying to unmute him, but in the meantime, kindly continue. So, so stem cell. So this is a treatment, and where in India, where thousands of patients have come for treatment at Neurogen, and this is the core team, the senior members of the team who do the treatment together.
Neurogen gamihar egar hawargina kodinna mewani haidde gawme egar hawargina kodinna mewani stem cell forward ifa den ane dichotomy fennani ane me kamgara kaiteri team egotun director Dr. Alok Sharma adi Dr. Nandini adi Dr. VJ Jacob adi Dr. Prena adi Dr. Hemangi, am I right?
Yes, Dr. Hemangi Sani, thank you. So this is a very senior experienced team that we have. About our infrastructure, so we have everything under one roof. This is our hospital where you are all welcome. Neurogen Brain and Spine Institute. It's an 11-story building, very near a very beautiful lake in Seawood. So a very beautiful location for the treatment.
Me then me if anybody yes later if any Neurogen hospital ge facility ta then egotong I facility minna ni navi Mumbai ga then leke carry ga aning follow da farai ta kabisama wara igam mahawda ka wan hai hiwan mitan.
This is our operation theater, state-of-art operation theater where the procedure is done.
Me operation theater de mitamaga me procedure ta Korean migenda ni.
This is the stem cell laboratory, again a state-of-art where high-end equipments and very it's like a temple or where very few people are allowed to go so that there is no infection. Everything is absolutely clean.
Mihar timeni wada gannawani stem cell laboratory de mit I waran hygiene ko balahatta tane komme mihaka wade wen tane no den hama bana lagwa mingan ta kai gota mitano masake koram mundani.
This is our stay facility, the rooms where the patient stays with their relatives. Then this is the comprehensive rehabilitation. We believe in teamwork. So all therapists they work together. So this is our physiotherapy department. This is the occupational therapy. Many of you have come here. This is our Autism Child Development Center where focus specifically for autism, which is made very child-friendly. Children love to come here and play. This is all the books that we have written for parents as well as for doctors, for information, for awareness, and freely downloadable on our website. We are ISO certified and GLP, GMP. These are certifications which talk about our credibility, and these are our awards, international awards from Europe and national award from at the national level for disability. These are all our achievements. So this is our contact number where you can reach us, neurogenbsi.com, and we will be able to help you. We can do virtual consultations for anyone who wishes to reach us. We would be happy to help. So we have two types of treatment plans, 1 week and 2 week. In 1 week, we have a 7-day treatment, 1 week where Sunday you come and you stay till Saturday. And in 2 weeks, You come on one Sunday, stay for 2 weeks and discharge the next Saturday. So in 2 weeks, you get the integrative therapies as well.
Me take modege treatment eva ole degotaka here kore vidana egotaki eng haftage treatment anigotaki de haftage treatment eng haftage treatment here koranya adita dohak durwa me jehani den de haftage treatment here kore sama adita dohak durwa me jehani den eng hafta vejjiyam haiddos ege terega nohimmene ne integrated treatment de hafta vejjiyam saara dos ege terega mihimene stem cell treatment ade gitaro integrated treatment. Doctor, you are on mute.
So stem cell treatment is a safe treatment. It is effective treatment for not only for autism, for other brain conditions like cerebral palsy and other neurological conditions. So it is a simple, safe and effective, no long-term side effects. Only side effect that we may see is in some children there would be a headache after the treatment for 2 to 3 days, which becomes all right after in 3 to 4 days. And in those who have a history of seizure or whose EEG is abnormal, there can be a 3% chance of increased seizure, for which we will give medicines.
Then stem cell laki collective gotek ama or rakateri treatment then doctor se vidalo gota mi ebe fonna faga mi korevani waram madara degge patient on by fara mi bolugari hon detindu wahigitere detindu haka honna kama noni hodun kala kama dima vedane kama then e gitoran mi koring fit jehe kojje vejjiyama fit jehon ituru bomge chance e bawa 3% mi treatment naga fiam then එකම විස් එක්තන පරවා දේනකම ඩොක්ටර් විදාලුවන්.
So this is a combination, it's a ray of hope, cell therapy with integrative and neuro rehabilitation. And I hope this seminar has been helpful for all of you. I'm happy to take questions. If anybody isn't wanting to have any questions, please put either in the chat or the question and answer segment and I will go through it. There are a few questions here, which I will start with. Mr. Ibrahim Yasir is asking, my daughter is 7 years old and she's very scared and disturbed of vehicle horn sound. So in India, I know the horn sound would be even worse than Maldives. So I was wondering whether she would be able to cope on the outside horn sound while in the hospital. So Mr. Ibrahim Yasir, I can assure you that the place where we are, there is hardly any vehicle or horn sound. We are in Navi Mumbai area. Navi Mumbai is a quieter part of Mumbai. It is in the suburbs where there is not too much traffic and our hospital is away from the main road. So she will not have any problems coping with the horn sounds. And we are hoping that after the stem cell treatment, this problem of her having sensitivity to horns and loud noise becomes lesser. So she will be able to cope, don't worry. Anybody else who wants to ask questions?
එමස් පේෆලක සුවාලෙක් කරම් බේනු ෆොලුවන්යාම චෙටුග ලියවම්වි. Then shall I translate what Mr. Yasir has asked? I think it will be useful for others.
Scientists believe these tiny...
Yasir SAV එබෙෆලගේ කුච්චේ වර හොඳකෝ එක අඩතන් වනේ මහසක මේ වෙහිකල් මෙයාලා බර්ගොනාඩු වනේම දැන් ඉන්දියාකි වර වෙහිකල් ගින තනවීම 11 ගස් ෆරෝය දේරස් ඒ හොඳකෝ දිමා වේදානෙත දැන් ડોක්ටර් විදාලවේ මේ ඒ ෆැසිලිටි මිහොන්න තනකි වර අනේ මේ ට්‍රැෆිකා දුරතනවීම ඒ තන ඒ ෆද මසල් එක්වනි මත නොවානකම
So in the meantime, till we get questions, Dr. Sharma is here, and we are honored that he is here to address you. He would like to talk to you as well as give his message. So I would invite Dr. Sharma for a brief chat.
Hello, everybody. Assalamu alaikum. I hope you enjoyed the webinar with Dr. Nandini. I'm sorry, I was busy with a couple of other things, so I've just joined late. I've been to Maldives. I'm completely in love with the country. I think you all people are blessed to be living in this wonderful country. We've treated many patients from the Maldives. They come here and, for us, it's like, you all are a family. So we look forward to being with all of you whenever you come to India, whenever you come to Neurogen. And we do have some big and exciting plans for the Maldives so that, more work can be done together. More of our children are able to benefit from the therapies. So I just wanted to say hello to all of you. And if there are any questions you have of me specifically, feel free to ask. I mean, I'm here. I just wanted to say hello and just welcome you all. So,
May I know time duration between first and second visit?
So, Amira Hussain has asked a question. What is the time duration between the first and second visit? Well, the time duration is 6 months. Ideally, it is 6 months. It can't be before 6 months, but a month or so after 6 months, like 7 or 8 months is all right. But we recommend a second shot at 6 months. Mariam Saidu says question from a parent, but Mariam, your question has not come yet. Have you answered these?
Yes.
So Mariam says, is there a chance of recovery of a child with physical disabilities? Yes, definitely, Mariam. We have treated so many children with physical disabilities. Children who have cerebral palsy, who have spasticity, tightness, inability to move their limbs. Children who are completely wheelchair bound for years are now walking after our therapy. Children who could not use their hands are now eating food themselves and are writing and are able to do amazing work with their hands. So we are able to help children with physical disabilities, especially if they are related to the brain or if they have a muscle, like, we have a condition called muscular dystrophy that results in physical disabilities. So we are able to treat those patients as well. Yeah, so the answer to your question is yes, we can definitely treat them. Any more? These have been answered.
Yes.
Mr. Ibrahim, please go ahead.
Just have answered.
Mr. Ibrahim, we've answered your question. You said your daughter is 7 years old and very scared and disturbed of vehicle sound. I think Dr. Nandini has answered that already. If you have any more questions, I'd be happy to answer that.
Question about optic atrophy. Question on optic nerve atrophy.
So Mariam says, is there recovery for damage of optic nerve? Mariam, the answer to that, it's very difficult to answer that like that. We need to know the following. We need to know the extent of the injury. So if it is a partial injury, then yes, it can recover. But if it's a complete injury, like the optic nerve is cut, then there is not a chance of improvement. Secondly, what is the duration between the injury and the treatment? If it's of recent onset, then yes, there will be an improvement. If it is many years old, then there may not be improvement. So with the brain, we are absolutely sure of recovery. But with the optic nerve, it depends on multiple factors. Now, very often, there is lack of vision because of a damage in the brain itself. The occipital part of the brain, which is responsible for vision, that is affected. And in such conditions, there is a definite improvement in vision. But if the injury is only of the optic nerve, and it's a complete injury, and it's a long-standing injury, then there may be no improvement. We've had improvement, partial improvement. We've treated patients. There were patients with multiple sclerosis who had optic nerve injury. We've seen some improvement there. It all depends on the type of injury. So if we have more details, what we like to do, we do an MRI, we do a PET scan, we do something called visual evoked potentials. Based on these, we try to understand the extent and degree and duration of damage. Then we'll be able to give you a proper answer. Thank you, Nita. It's a pleasure being with for the webinar. It's a pleasure actually to participate in anything to do with parents from the Maldives. And okay, Dr. Safa says, how should we come on head banging? Overcome. Dr. Safa, it's like this. Head banging has got two components. There is a sensory component sometimes, and there's a behavioral component. All right. And both of these have to be addressed jointly and separately. So for the sensory component of head banging, we have a special program called sensory integration. We have a very senior and an experienced sensory integration occupational therapist who does phenomenal work with the sensory aspects. We've seen patients, in fact, just recently, a few months ago, we had a small girl who would be banging her head almost continuously, so much that she had big lumps on her head because of that when she came to us. And then just with our rehabilitation program, we gave stem cells, the head banging almost completely stopped. There is also a behavioral component to head banging. Here is where our psychologists, working on a special type of therapy called behavioral therapy, they are able to help. So the stem cell therapy will help along with sensory integration and behavioral therapy. Zeenat says, is there any stem cell treatment for kids who have challenging behaviors due to puberty or adulthood? No, actually, Zeenat, this is, we cannot treat normal children who have a problem. We can only treat children who have a problem because of brain damage. So that is why we do a PET CT scan of the brain, which shows us whether there is any damage to the brain. Stem cell therapy is a medical treatment. We cannot use it for normal children who have behavioral issues due to society, psychological, family, or environmental issues. But yes, if they have a disorder, if they have autism, if they have an attention deficit disorder, if they have learning disability, if they have any issues like that, if they have intellectual disability, we can definitely help. Stem cell therapy has a very significant role. And, so all depends on, a question like this is difficult to answer in a webinar. But if you send us the details, a detailed report of the patient, a video of the patient, we'll be able to give you some sense whether we can help or not. All right. I don't know. So, Aminata, do you give treatment under Asanda? I don't know what is Asanda. Can somebody clarify that, please? What is Asanda? Is it a scheme, government scheme or something?
Actually, it is universal health coverage scheme for all Maldivians.
No, we are not covered under that. At present, we are not. But it's a good thing that you've told us. What we will do is we'll initiate a communication with the government, and we will try to see if it is possible to try to get coverage under that. We will make some attempts. So we weren't aware of the scheme, but we'll definitely make some attempts.
Doctor, I have a question.
Yeah, please.
Actually, we have around 30 patients who are affected by myasthenia gravis. Is there any hope for them?
30 patients with
Yeah, in one island.
myasthenia gravis.
Yeah.
No. Myasthenia gravis at present is not treatable with stem cells. All right, I think Mohammed Soba has said that Asanda helps for the ticket. So we've just got information from one of our parents of one of our treated children that so Mohammed, yeah, so we've got information from Mohammed Soba that Asanda will help you for the ticket. At this point, it doesn't pay for the treatment, but even getting help for the ticket is good. Any other questions? That's good. So Mohammed tells us that he actually got help from Asanda for the ticket. So I think all those of you who want to come to Neurogen for treatment, please apply to Asanda ticket and get help from them. And Mohammed Adam says that NSPA provides 500 USD money only. So apparently from NSPA, you can get 500 US dollars and Asanda will help for the ticket. I mean, that's the information that we are getting from people who are participating. Oh, that's good news. I mean, whatever little help we get is help. That's good. Yeah. Oh, it's NSPA is the National Social Protection Agency. For that, we have to register Neurogen or Asanda Empanel Hospital. Okay, we'll work on that. We will work on trying to get ourselves empaneled with both Asanda and the National Security Protection Agency. We'll start working on that right away, and then we'll take it forward. Yeah. Thank you. Zinat, I thank you for this information. Zinat Hassan, thank you for this information. We will definitely make all attempts to get empaneled. All right, if there are no more questions, so we'll get to you. And I just want to share with you something interesting we did recently. And there was just a couple of weeks ago, We had 5 families from the Maldives at one time, 5 families. And what we did is Dr. Nandini and myself, we just had a conversation, just a friendly conversation with 5 fathers and the 2 of us about the challenges, about the difficulties of having to look after a child with autism, the challenges, the hope, what it was like hearing about stem cells, or some of them had taken stem cells some time ago and the children had improved a lot. Some had just recently taken. So we'll share that video with you. I think by next week that the video, we were hoping to get it ready before today, but unfortunately it's not ready. On Monday or Tuesday, as soon as it gets ready, we will share that video with all of you. It's a very interesting video of 5 Maldivian fathers, all sharing the journey, which is common. And, we'll share that video with you. And before I sign off, I want to specially thank, the fathers of Muhammad Soba, Muhammad Adam, and Adam Shafiq. Salam alaikum to all of you, all 3 of you. Thank you so much for participating in this meeting and sharing your life's experiences. So Muhammad Soba, Muhammad Adam, and Adam Shafiq, thank you so much. I'd also like to thank Muhammad Akram, our translator. Thank you, you did a brilliant job. Before I came in here, I was actually, I entered as a participant because I was driving. So I was hearing, and you've done a very nice and clear translation. Thank you so much. And we look forward to being in the Maldives soon and, meeting with all of you sometime maybe. So take care. Inshallah, we all will meet soon. Thank you. I'm handing over the thing to Dr. Nandini.
Thank you so much, Dr. Sharma, sir. Always an honor to hear from you, and such an inspiration service for all of us. So if there are no more questions, then we will sign out, and I wish you all a very, very happy weekend. Take time out for yourselves. It's not easy to take care of children, especially in children with special needs. So take care of your health and have a great weekend. All the best. Thank you again, all the parents, for the participation. And yes, we will be recording. We have recorded this session, and soon we will send you a link of the session. Yes. And those who want to have a one-on-one consultation with either me or Dr. Sharma will get an opportunity to do so in the next couple of weeks. So please do let us know if you want to have a one-on-one virtual consultation. Thank you so much, Ihavandu Women's Community, and for the mothers who have come together to know more about what they can do for their children. And I hope this webinar has been useful. Thank you again, Mr. Muhammad Akram, and really, really, indebted to you that you took out time for us. And I hope that the women in your community have understood in a very simple language what is possible with stem cell treatment and rehabilitation. Thank you so much.